Good morning, namaste, and vanakkam. On behalf of the Kidney Warrior Foundation, I'm Marianne. Take great privilege to welcome you all to the KWF Virtual Conference 2020, which is the first of its kind in our attempt. And we are super excited to be here, and I'm hoping that you are excited as we are. So wherever you are this morning, sit back, relax, fasten your seatbelt, because we are ready for takeoff. And to start off this morning's program with a smile on our face and love in our hearts, I want to request you all to please put your hands together for a big round of applause for all of us who actually come together as a community. And on a lighter note, to start this program, we have with us a very special dance team to give us the opening dance performance. This is Team 5678 from Bangalore, which is one of India's leading dance teams. They have traveled across the country, across the globe, capturing the hearts of many of their audience, just like they're about to do in this performance. So ladies and gentlemen, boys and girls, wherever you are this morning, please put your hands together for Team 5678.
Gajendra Vimardana Ta Dipika Tagadigin Tata Digin Tata Tagin Da Dipika Tagadigin Ginagda Da
संभाल जट्टा पगड़ी संभाल पगड़ी संभाल जट्टा पगड़ी संभाल लुटना चाहे माल जट्टा पगड़ी संभाल की जंजीरें बदल दे तू अपनी तकदीरें पड़ जाए साहिल के पल्ले कर दे इनकी बल्ले हवाले छोड़ गुलामी की जंजीरें बदल दे तू अपनी तकदीरें पड़ जाए साहिल के पल्ले कर दे इनकी बल्ले हवाले पगड़ी संभाल जट्टा पगड़ी संभाल पगड़ी संभाल जट्टा
Thank you, Team 5678, for that beautiful performance and setting a tone to this wonderful morning. I'm hoping that you all enjoy that performance as much as they enjoyed putting it up for us. To move one step ahead this morning with our formal inauguration ceremony, I would like to take a pleasure to introduce to you our chief guest and the guest of honor of this event, Dr. Balal. Thank you very much, Dr. Balal, for joining us this morning. It's such a privilege to have you with us. And of course, the other doctors who have joined us in spite of their busy schedule. It is such a joy to have every doctor to be a part of this wonderful virtual conference. And not forgetting a lovely patient body, the Kidney Warrior Foundation, which includes donors, recipients, caregivers, and all the lovely people who just care for the community. We welcome you all to our virtual conference. And to formally inaugurate our virtual conference and to share a few words with us, ladies and gentlemen, may I request you all to please put your hands together for Dr. Balal to please share a few words with us this morning.
A very good morning to all of you. At the outset, I would like to say a big thank you to Vasundhara, Vibha, and the organizers of the Kidney Warrior Foundation, and of course, my very good friend, Dr. Sundar, for inviting me to be here. I deem it to be a great honor and privilege. There are two main reasons for me to be here. One is that I'm a great believer and fan of patient advocacy. And also the other very important reason is that this is a great opportunity for me to connect with all my friends who I have not seen for a very long time, albeit virtually now rather than in person, which has become a way of life in the COVID era. When I say we, people of my age group, either with gray hair or no hair, where medical students and young practicing doctors, practicing medicine was a one-way street. The doctor spoke and the patient listened. No questions, no counselors, no patient advocacy, no second opinion. It was truly an autocratic world. But that has considerably changed in the last few decades. Practice as medicine changed quite a bit and rightfully so, I should say, in the last few decades. Now the patient talks and the doctor listens. If the doctors do not listen, they will find one or more doctors who will listen to them. Since by and large now the society and the patients are well informed, it is a great idea for us to have a patient advocacy group and counselors so that the patients are comfortable with the decisions they take. A patient's group interacting with patients and making them aware of the patient's rights has far more value than a one-sided conversation. I'm very proud that Vasundhara and the Kidney Warriors Foundation and her group are leading from the front in this area and have done a superb job, and would like to congratulate them for setting up the KW group. They truly are our brave warriors, spreading the message and creating awareness about kidney disease. I also would like to add one more issue which is very close to my heart, and that is the concept of the power of the second opinion. When we were growing up, and to some extent till recently, many eminent doctors would balk at someone asking for a second opinion when they have given an opinion. But I think that is something that we need to learn about. I think a patient who seeks a second opinion should be encouraged to do so, maybe even facilitate that. And a patient who takes a second opinion then comes back to you, they would have met other doctors, maybe even get counseling from their fellow patients. And if he agrees with your opinion, that's a far better bet that they'll follow your instructions than someone who doesn't like your opinion but is still forced to take that opinion. We have some very eminent speakers today and a great moderator, of course, my very good friend, Dr. Sundar, to conduct the proceedings. There are many interesting, relevant topics to be covered, like patient advocacy, transplants, dialysis, pediatric CKD, nutrition, and other topics, followed by an awards and recognition session. I'm sure this will be a very interesting conference and a very productive one too. I have great pleasure in inaugurating this KWF virtual conference, and I'm sure all of you will enjoy this. God bless. Jai Hind.
Thank you very much, Dr. Balal, for sharing a few words with us this morning and inaugurating our Kidney Warrior Virtual Conference 2020. Well, to now move on to our first session that we have for you this morning, patient advocacy. And this session will be headed and moderated by Dr. Sundar from Manipal Hospital. With more than 35 years of experience as a nephrologist, Dr. Sundar is one of the most loved nephrologists, and I'm sure you will agree with me on that. So ladies and gentlemen, without further delay, may I request Dr. Sundar to please take over the session on patient advocacy and introduce us to the rest of the panelists.
Good morning, friends. At the outset, let me thank the Kidney Warrior Foundation and all the participants for giving me a chance to moderate the session. Patient advocacy is something which, as Dr. Balal said, especially elder senior doctors like us, we have never thought of it as a concept. But the fact that we are talking about patient advocacy is a great thing, and I admire the Kidney Warriors for organizing this meet, because this is one thing which is very important now with the power of social media, power of knowledge, internet. I think the patient needs to have an advocate. I know that donor advocacy is one thing which I was involved when the hospitals were being accredited for transplantation. But patient advocacy is something which all of us have to know, and we have eminent speakers, colleagues of mine, and many of us, I know that we personally may not know much about patient advocacy. So this is a good beginning. I'm happy that the Kidney Warrior Foundation, predominantly formed by patients themselves, is a great thing. And as I look at it, the International Society of Nephrology has got a separate page for patient advocacy, and Vivekanand Jha, our president of the ISN, has done a lot of work on this. We are going to hear him next. So I would now request Dr. Vivekanand Jha's talk now. I would like to introduce Dr. Vivekanand Jha, please. The post of International Society of Nephrology presidency, a singular honor for an Indian, and as a fellow Indian, I feel proud that I'm in a session where he is taking part. Vivekanand Jha was the former professor in PGH Chandigarh, the prestigious Institute for Nephrology. Now he's the director of the George Institute of Global Health. And apart from that, he's a good friend of ours, a great human being, and at any point of time, whether it is patients or colleagues, he's always there to help us. So it'd be nice to listen to Vivekanand Jha on the international perspective and also the role of patient advocacy in India. And I request Vivekananda to do his presentation. Thank you very much.
Hello, everybody. It's really great to be with you on this first of its kind event. And thanks for Kidney Warriors for putting this together so that we are able to start our journey together on making sure that we have increasing space for patient voices in healthcare delivery so far as kidney care is concerned. Now, for almost all of our lives, healthcare delivery has been primarily driven by physicians or healthcare systems. So it's time now that we moved from physician-centered healthcare delivery to patient-centered or consumer-centered healthcare delivery. This has been brought into sharp relief by the COVID-19 pandemic, in which the importance of care to patients specifically with kidney disease has come into sharp focus because patients with kidney failure have endured a number of hardships, especially in their ability to access life-saving dialysis treatment, which has been hampered both by the pandemic and by the responses of the government, of the administration, of hospitals, of the healthcare system to how the pandemic is managed. Interruption of supply chains, interruptions in hospital-based care has really affected their ability to access appropriate care. Transplantations have been stopped, which has caused undue anxiety to all the patients because they have to continue on dialysis, which is obviously less preferred compared to transplantation. And also they have to live in a period of uncertainty because they don't know when transplantations will resume. Now, if we just get to a bit of a background, the Indian healthcare system has transitioned from several decades of high degree of focus towards care of infectious diseases and care, of course, and all of that was appropriate to pregnant women to ensure safe delivery and safe care to the newborn. And India has made great strides in improving the indices. But over the last 20 years or 25 years or so, we have seen increasing rise in the burden of non-communicable diseases. And there is a major difference between the acute conditions, infectious diseases and pregnancy, because the care for those health conditions was primarily hospital-based, whether it is management of acute infections or institutional deliveries, etc. The patients are expected to come and reach some healthcare facility. But non-communicable diseases, they are chronic, they are related to lifestyle, they are going to be with the patient for the rest of their lives, and they're highly related to the way the patients live and to their socio-demographic parameters. So it is really important that these conditions are picked up and treated where these people live, they work, they play, and they pray. So involvement of the community is extremely, extremely important, really. And when I say community here, I mean not only the patients, but also the healthcare workers who live and work in the community and know how patients live much more than most of the city dwelling doctors do. So in this, what is really important is our ability to listen to patients' voice and use those voices to determine how we deliver care. Now, for as long as healthcare has existed, priority setting in healthcare has been largely conducted by economists, by politicians, by healthcare administrators, and by physicians. As a result of this priority setting, or you could say as in the absence of any such formal priority setting exercise in India, healthcare delivery has become largely concentrated in private sector. Private sector as a group has its own incentives and disincentives, which are not necessarily aligned with the interests of the patients all the time. So it takes us really to the goal of healthcare delivery. Who decides what kind of healthcare delivery should be appropriate for a given community and for the people who live in those communities. The voice of patient has, to tell you the truth, been largely absent from these decisions. It is the person with the disease that really understands how the disease affects her or him, what is really the impact of each aspect of disease on their lives, on their livelihoods, and on their ability to remain a productive member of the society. So that lived experience is the one that should inform models of healthcare delivery, which hasn't been happening in the past. So it's really great that over the last several years, we have started recognizing the importance of treating patients as partners in deciding how to deliver healthcare in all aspects of healthcare, specifically in care of kidney diseases. In the past, the patient community has also suffered from a huge amount of information asymmetry. What I mean by this is that doctors were treated as really the repositories of information, and patients came with practically zero information and expected that doctors will really transfer some of the information, whatever the doctors thought appropriate, to patients. That has changed over the last several years because information is now an increasingly accessible commodity with internet, with increasing availability of several kinds of media. The second thing that has happened over the last decade or about decade and a half is the growth in evidence-based care. So what evidence-based care means is that individuals should be treated with the interventions, whether it is pharmacological interventions, other surgical interventions, interventions with some device, or even receive the kind of diagnostic test that many people get, only after they have been proven to improve some important outcome for the patients. So it should not be that we treat patients just because we have a feeling that this treatment should work. It is important that physicians and surgeons and all the healthcare professionals discuss the various treatment options with the patients across the table and then agree on a treatment which is most appropriate for that person. So this concept of shared decision-making is also important. In the nephrology or kidney disease space, there have been a number of initiatives in which the patient voices have been brought in, and it has given us very important lessons. We have learned that many times the kind of outcomes that physicians think to be important are not perceived to be important for patients. So for patients, quality of life is important. Their ability to enjoy a healthy life with their family members, and life experience and fatigue, those are the kind of things which are important as the length of life. So that's something which is a parameter that we need to factor in making our treatment decisions. All of this requires advocacy. Advocacy also is best done by a team. So here we need to work with our patient partners. And I have to say that to work as a team, both or maybe more than two groups need to be appropriately trained on how to do this. Physicians need training, but patients also need training. And in this, we need to work with other groups such as sociologists and other social workers who have been doing this in the past. It's only when we do this together that we will be able to make our movement towards the Sustainable Development Goals, which have been embraced by all countries around the world. And a key component of Sustainable Development Goal related to health is universal health coverage, which means that everyone should have access to essential preventive care. There are a number of diagnostics, there are a number of medicines which have been designated as essential medicines and essential diagnostics, and it is the right of everyone to have access to that. The second thing which is important in Sustainable Development Goal is prevention of catastrophic healthcare expenditure, so that anyone should not have to spend more than that they are able to spend based on their ability, so that they don't, slide down into poverty because they need to spend on health. To do this and to reach this goal, we need to take a whole of society approach. And the whole of society approach means that we need to take a holistic approach towards management of these chronic conditions, which include kidney diseases. And we need to work with all stakeholders, so whole of society and whole of government approach. And so it is on this journey that I'm really pleased to be able to join with all of you, with my physician colleagues, and with all of you as patient partners. And we do hope that we will be able to settle on a common agenda on which we will work together to reach on our common goal, which is to ensure sustainable healthcare for everyone in all parts of the world in a manner that is equitable, that is sustainable, and that is affordable. Thank you very much.
I would like to thank Professor Vivekananda for his excellent talk on India's concern and from the international perspective also on patient advocacy. The next speaker is my very close friend and eminent colleague, Dr. Vijay Kher from Medanta, Delhi. In fact, I fondly call Vijay Kher as the Rajinikanth and Tendulkar of nephrology. And he actually needs no introduction to the nephrology community and to the patient community. And he is going to speak something which is close to the heart of many of us senior doctors, doctor-patient relationship. In fact, down the line, trust has gone between doctors and patients. And as my colleague, Dr. Balal, keeps saying, you have to get back the trust. I think trust is the essence of cure. And at this juncture, I request Vijay to give his thoughts over the last 40, 50 years on patient-doctor relationship, how it has been, how we can improve. Vijay Kher, please. Thank you.
Good evening, kidney warrior friends. It's a pleasure to be talking to you today. I'm going to talk of patient-doctor relationships. The doctor-patient relationship, unfortunately, over the last many years is progressively gone down, and the trust between the doctor and the patient is really ebbed down to a very low level, to the extent that doctors are considered to be very arrogant and may not be doing things in favor of the patients, and therefore you hear stories of doctors being beaten because this trust has gone down too low. There is no doubt that doctors were at one point of time considered to be gods, and everything that they would be telling the patient would do all that was being told to them. But no longer that is happening. And there is no doubt a need for improving this doctor-patient relationship. I think the greater responsibility of improving this relationship lies on the doctors, because they are the ones who are most educated. They are the ones who know about the disease that the patient is suffering from and what is the kind of best treatment for that patient. It is only that they should act in a manner that this deficit of trust that has happened between the doctor and the patient needs to be repaired, needs to be improved. And I think it's extremely important for medical facilities as well as physicians to understand that patient has to be the center of all the attention that is required for the care of the patient. And unfortunately, what has happened is that we have tried to make facilities for patients better, but I think in the process of trying to give him better facilities, for which he's not as much concerned. He's not as much concerned about that, is there a very good lobby, is the waiting area as comfortable, or is the canteen as good? But I think he's more concerned in a hospital about the quality of care that he is going to get. And I think that is what we need to improve between this doctor-patient relationship. I think it's extremely important that we communicate with the patients and their families in a fashion that is understood by them. It is caring, it gives hope, as well as it tells them the truth about the disease. Many times we feel that patients come educated either from Google or and when they ask questions which are related to whatever knowledge they may have gained. It may have been an imperfect knowledge that they have gained, a question which they may have learned either reading on the internet or on Google or through a friend. And when they ask the doctor, sometimes doctors get irritated because it gives them feeling as if they are being threatened with a kind of question that challenges their knowledge or their understanding about the disease and what they may be. But I think it's very important to educate our patients. They must get good education about their disease, and the responsibility of this should lie on the physician. It's quite possible that on the internet, they may not be able to filter out the kind of knowledge which is existing on the internet. There is a lot of knowledge and a lot of garbage also on the internet. To filter as to what is relevant to the patient and what is going to be appropriate for the patient is difficult even for doctors to filter from the net, because the amount of the content that is available on the net is huge. So it's extremely important to filter that. And I think it's the responsibility of the physicians to build that trust of communication between the patient and the doctors, that they can improve this trust. I think it's important, that I think there are 7 kind of categories by which we can improve this trust, and that is related to that we should have transparency of the information that we give to our patients, which is consistent, which is also scientific. And I think it's important to make a patient a partner in the kind of care that is to be given to the patients. And I think it is extremely important to coordinate this between the relatives, the patient, and the doctor. And I think it is the lack of this transparent communication which has led to a kind of trust deficit amongst the patients. And I think if we create this background of transparent communication with the patients, then it's easier to rebuild this trust. We should also be able to find out from the patient that how much would they want to be participating in taking decisions about their care. And I think it's important to make patients as a partner in the care decision making. If you don't make them and you decide as to what should be done for these patients, sometimes you make wrong decisions about the patient. And I think many times doctors feel that patients may not be in a position to make the right decisions for themselves, and therefore, in case there was an emergency which was required in the post-transplant period, and if they had this money and they were able to use this drug, this would be the kind of advantage that they were looking at. Let them decide. And I can tell you that you will be surprised that 96 out of next 100 patients decided to take this drug. So this is a huge learning which happened to me in very early part of my practice and has been extremely useful to me, from creating that kind of trust with the patient by a transparent explanation of things to the patient's relatives. I think we should also try to understand what are the determinants of whether the patients are capable of paying, what is their capability of paying, and this must be discussed openly with the patients. What are the advantages, disadvantages of particular options? If he doesn't get this treatment, what would happen to that patient? What are the long-term and short-term outcomes related to that disease, and how is it likely to affect his family's life as well as the long-term effects on the patient? And I think as long as this discourse with the patient is transparent, is scientific, is open, and one includes patients and their families and their friends into this discussion, depending on who wants a particular person to be involved in the discussion, in the decision making, one should be able to build trust between the doctors and the patients. I think the other thing obviously should be that doctors have to provide leadership, have to provide trust and hope to these patients, and even in desperate situations where patients are not feeling as good, it would be important to tell the patients that there is reasonable amount of hope, and they should, whatever is the consequences of that disease, and they can be taken care of by you. Even in desperate situations, if you show emotional satisfaction to the patient and emotional kind of support to the patient, and provide guidance in the form of, many times I have used the word that if it's an elderly patient, that if he was my father or my brother or my sister, this is what I would do for them. And that helps patients many times to take decisions which are difficult many times. And one isn't very certain. In this trust deficit, it gets extremely difficult that there may be motives related to a particular decision, clinical outcomes of the patient, and we forget about the patient as the center of that, determinant of that outcome. And I think what is important to the patient is extremely important to me, should be very important to me. What is important in my perspective for the patient is not as important. And what is important to the patient, what determines his quality of life, what determines his overall goals of his life in relation to that disease is important. And I think as long as doctors include these perspectives of patients into the overall patient review charts, when we do clinical review charts, we should also look at what are the emotional needs of the patient, what are the social needs of the patient, what are the financial consequences of the treatment on the patient, and where are they going to be leading this to, and how they will impact the ultimate decision about the type of care that this patient is going to receive. And I think these are important elements which a clinician must include in the overall care of the patient. If all of this is done effectively, then I think it's extremely going to be good for improving the patient and doctor relationship. If one senses that there is this trust deficit, and despite all the effects, that all the things that one has done, if this trust remains, it would be better to suggest to the patient to maybe taken care of by another doctor if that trust deficit is not repaired. And I think the responsibility, as I said earlier, is with the doctor. He is the leader of this relationship, and I think he is the one who should be driving to improve this relationship. I'm sure patients are dependent on doctors to decide what kind of care they need to be given, and what kind of drugs need to be given, what kind of treatment needs to be given. And obviously they hold him in huge respect. But this respect obviously needs to be sustained by continued transparent communication with the patient. And in my practice, I feel that what I would have done if this disease occurred to one of my relatives or one of my friends, what is the kind of treatment I would have suggested to them? That is the kind of treatment I would suggest to the patient. But obviously, every patient will have a different social, different family background, and different financial backgrounds and all that. And all of this needs to be woven into this to create an ambience of trust, which is very, very sacred between the doctor and the patient. I hope that with these kind of, I think the responsibility of patients is also there, and they must not sort of disrespect, obviously, a doctor. And I think even if there is a difference of opinion, these must be expressed openly. And in India, sometimes because doctors are held in awe, many times patients don't open up to doctors in a frank kind of discussion. I would feel that patients must get into a good amount of discussion about their diseases with their doctors without any fear or any holdback. And it's only when this communication becomes open and transparent between both the parties that then the trust will be gained again. And I hope that that happens. I hope that with these points which I have mentioned, one should be able to improve the relationship between the doctor and the physician. And I'm sure that the trust which used to be there between the doctors and the patients earlier would be regained. Thank you.
Thank you, Vijay, for the excellent analysis of the doctor-patient relationship. As usual, in your inimitable style, simple way you explained what is important. And I'm sure many of the things which you suggested, other doctors and colleagues should be able to follow. The next speaker is Bharat Shah from Bombay, a good friend, and he is supposed to talk on uniform practices in patient advocacy. But I think he's also talking on CKD prevention and the cause of CKD. Bharat, is always been a person for the patient. I remember that he even goes to court to get help for the patient. Sometimes in transplant, a lot of legal issues come in. Bharat is one person who has gone, taken help of courts and taken help of media to solve the problems of the patient. So who else we can have other than Bharat for supporting the cause of patient advocacy? I request now Bharat to do his talk. Thank you very much.
Good morning, everyone. This is Dr. Bharat Shah from Narmada Kidney Foundation and Global Hospital, Mumbai. Chronic kidney disease is a major problem all over the world and even more in India. It poses a great socio-economic burden on the patient, the family, and the society. This is essentially because of increasing incidence of obesity, diabetes, and high blood pressure. The major challenge with chronic kidney disease in our country is that it is often diagnosed late, at a stage when not much can be offered. These cases are at increased risk of cardiovascular disease, which means heart attack and stroke. And those who are lucky to survive through this cardiovascular disease will unfortunately progress to end-stage kidney disease, what is called as kidney failure. In our country and all over the world, there are limited treatment options for chronic kidney disease, and this includes lifelong dialysis and kidney transplant. Both these options are available mainly in urban areas, whereas 70% of our population lives in rural areas. Both the options are extremely expensive and beyond the means of most common Indian population. As a result of this, barely 10% of patients who develop kidney failure in our country have an access to renal replacement therapy in the form of dialysis and kidney transplant. You can imagine what happens to remaining 90% of people who develop kidney failure. Even those who have an access to treatment, many of them drop out after a few months with tremendous financial loss. And those who are able to go on dialysis and who are able to go through kidney transplant have a compromised quality of life, particularly dialysis patients who have to go to dialysis center 2 or 3 times a week and have a shortened survival. With all these challenges, what systems and practices should we be following in our country? First and foremost, we know that prevention is better than cure, and therefore we should strive to prevent kidney disease. I told you that the most common causes of kidney disease are obesity, diabetes, and high blood pressure. These are preventable problems. And even those who do develop diabetes and high blood pressure, with availability of medicines and close monitoring and education, these conditions can be well controlled. And when diabetes and high blood pressure are well controlled, all the complications can be prevented. So you would not only prevent kidney disease, but you would also prevent heart disease, stroke, diabetics end up with amputation, blindness. All these complications can be prevented. We at Narmada Kidney Foundation conduct regularly screening camps in urban and rural areas. We have so far screened about 5,500 people, 4,000 in urban areas and 1,500 in rural areas. And it is so unfortunate to find that 60% of them are overweight or obese, 40% are hypertensive, and 15 to 20% are diabetic. And almost 40% of those who have diabetes and high blood pressure are not even aware. It is only in our screening camp that they are identified for the first time. So this being the problem, obviously the incidence of and prevalence of chronic kidney disease is going to increase. And we as a society, we Indians in this country, need to work hard, create more awareness at all levels about obesity, diabetes, and high blood pressure. Today, if you detect kidney disease at an early stage, it is possible to stabilize kidney function. Unfortunately, this is not realized by many people, and they often progress and present at a late stage, as I said in the early part of my talk. Just yesterday, I saw a young man of 27 who a year back, as a part of his routine health checkup required by the company, was found to have severe high blood pressure and creatinine of 2 milligram per deciliter. Creatinine is a marker of kidney function. Normal creatinine is 1. Higher the creatinine, this is your kidney function. And I am surprised that neither the center which did the health check, nor the doctor, or maybe the patient himself, ignored this, and he took no action. And then a year later, sometime in August of this year, he presented to an emergency department of the hospital with severe breathlessness. He was found to have severe hypertension and advanced kidney disease, and he had to be put immediately on dialysis, and now he's being worked up for kidney transplant. All this could have been prevented had he acted 1 year back and controlled his blood pressure. Not many people realize that high blood pressure can be a marker or an indicator of an underlying kidney disease. And when someone is found to have high blood pressure, they are often referred to a heart doctor, a cardiologist, when in reality, they need to be seen by a kidney doctor to find if there is an underlying kidney disease and start an appropriate treatment at the right time. Patients with early stage of kidney disease, if guided to provide any acute insults to the kidney, like painkiller medicines, alternative therapy, they can really stabilize well. Some patients, under the misconception that alternative therapies are completely harmless, unnecessarily resort to these therapies and then rapidly progress to advanced kidney disease, when their own kidneys could have worked for whole lifetime. an important message for all is that don't take unnecessary medicines. God has given us an excellent body. Most of the problems heal by themselves. When patients present at an advanced stage of kidney disease, they can be guided to plan their future treatment. We at Narmada Kidney Foundation and Global Hospital conduct a kidney workshop every Wednesday at 1 o'clock. And this is done on a virtual platform. Those interested can join by registering at our Narmada Kidney Foundation office by calling 704 555 2030. They will be given a link to join and they can attend this virtual kidney workshop and they'll get wealth of information which will help them in planning appropriate treatment. A majority of our patients with progressive kidney disease, once they advance to a later stage, we guide them and we take them directly for transplant. No making AV fistula, no putting catheter through the neck or through the groin, no dialysis. Many people spend money on dialysis. We could have completely taken care of their kidney transplant. This counseling is very important, and those interested can attend our virtual kidney workshop. As I said before, a very small percentage of patients getting kidney failure get kidney transplant in our country. One important reason is severe shortage of kidneys. Kidneys can come from a living person, which by Indian law has to be from a family member, and that may not always be available. But kidneys can also come if the families of brain dead patients were to consent donating their organs. That would not only help kidney patients get a kidney, but most importantly, patients with liver failure, heart failure, and lung failure can also get organs for transplant. For patients with heart and lung failure, this is the only hope for their survival. So it is our moral duty to pledge our organs after death by signing an organ donor card. The message to the society from our Narmada Kidney Foundation is, don't take your organs to heaven, for God knows they are needed here. Many people wonder what happens if they don't go to heaven. So we have made another message that if you donate your organs, you will definitely go to heaven. So my dear friends, I have three important messages for you. Please take care of your kidneys by following a healthy diet and a healthy lifestyle. Try and see that if you have early stage of kidney disease, you are seen by a kidney doctor and don't resort to unnecessary medicines. And yes, we all must pledge our organs after death by signing an organ donor card. Thank you. Thank you for this opportunity to give this message to the society. And if this is followed all over the country, I think we will do much better and the challenges of chronic kidney disease will drastically come down. Thank you.
Thank you, Bharat, for the excellent analysis of CKD prevention, and I've also spoken on the organ transplant law, who can have transplant. I know directly it is not the patient advocacy, but it's also important for patients to know when to approach a doctor and how to prevent CKD. So the next speaker is a renowned nephrologist from Western India, a place called Nadiyad, my good friend, Dr. Mohan Rajapurkar. He has done a lot of work. In fact, he has got the American Nephrology Indian Origin Distinguished Service Award, one of the few Indians to get that. He's also, we can say, a father of the CKD Indian Registry. In fact, India, we do not have much statistics on CKD. It has always been what I call guess estimate or guesstimate, but thanks to Mohan and his team, we roughly know what exactly is CKD, the numbers which are occurring in CKD. Mohan is going to talk on patient advocacy tailored to patients' needs. And Mohan comes from Nadia, the Mujalibai Urology Center, very world-renowned. In fact, he calls Nadia, there's a place where it is dirt, donkeys, and doctors. Such a place, he has made it world famous. People around the world seek his help. And I know even the Rajasthan former chief minister once told me that Rajasthan or Jaipur should have a Mujalibai urology model, and that credit goes to Mohan Rajapurkar. Mohan is ably supported by his wife Sujata Rajapurkar, who does a lot of work on counseling. I'm sure we can take his help in patient advocacy. Mohan Rajapurkar, please. Thank you.
Well, thank you very much, Kidney Warriors, for giving me this opportunity to speak about patient advocacy tailored to the needs. I assume that the needs is of the patients. Let me start with a disclosure statement that I do not have any, I've not done any patient advocacy myself and do not have any expertise on the subject. So I started looking at the patient needs. When you look for things, what I would first say is that we really do not know, because we have not included patients and their caregivers in the process of designing our studies, forming policies for care delivery by the doctors as well as the regulatory and insurance agencies. We have not involved patients and their caregivers while designing our laws. For example, when we designed the law for organ transplantation in our country, we did not involve patients or patient representatives to say what are their needs. And we designed it usually based on either taking a copy-paste option from somewhere else. And that is why the difficulties that patients go through while undergoing the paperwork required and the legal process required for undergoing transplantation becomes more and more difficult. No one told us doctors while we were training that we need to look for patient needs. We were told how to pass exams. We were told how to make a diagnosis of a disease. And we were told how to treat those diseases based on the outcomes, which are often driven by the laboratory or by the imaging to say that the patient's laboratory reports look better. However, we did not really train ourselves to understand what are the problems that patients go through as they are undergoing treatments, as they're facing their disease, as well as facing their caregivers, both at home as well as professional caregivers. Strong patient groups, especially for kidney disease, are rare in our country, except maybe one or two that I can name: Mohan Foundation in Chennai and the Amar Gandhi Foundation in Mumbai, and probably do not have adequate support financially to run their organizations to go on a regular patient advocacy programs with many people. So what are my perceived needs that the patients have? Most important is financial support in the time of crisis that a patient goes through when a kidney disease is declared. Often a serious kidney disease like kidney failure, which is irreversible, is declared to the patient. And many a times these patients are asymptomatic. So therefore, suddenly they have a huge financial burden. Say, for example, if you wanted to consider doing regular dialysis, even if you did it at home, that would cost you about 30 to 35,000 rupees a month. Or if you wanted to do a kidney transplant, reasonably, one would spend something like 5 lakhs of rupees for the procedure itself, and then about 10 to 15,000 rupees per month for maintenance immunotherapy that they will have to take all their lives. Usually, where does the patient look for financial support? Very often they have to bring it out of their own pockets, for which they may have to sell not only their savings or break their savings, but they will also have to give up their assets, they will have to liquidate their properties. So not only does the patient get affected, but the family also. Government supports, but because there is no advocacy, the government does, though it does free treatment, often the quality and outcomes of the treatment are not clearly known, or there is a lack of social as well as emotional support to the patients, also the caregiver and family, for improving their quality of life. Now, this is a relatively neglected area. Like as and when one comes to know of a real bad disease, one starts first with denial that this can't happen to me. I've done nothing wrong. And it is during this denial phase that patients go helter-skelter and don't get treatment because they don't have adequate social and emotional support. And therefore, this needs to be properly designed. Adequate counseling skills of the doctors, the caregivers, and the family is needed. Now, once a patient then comes to an institution for treatment, there is no way in which they can identify which treatment center should they go to. And therefore, some categorization of treatment centers by the advocacy groups is needed. Psychosocial support during the evaluation of the disease, the treatment process, and there is a need for handholding by counselors while going through difficult treatments, going through complications of the treatment, going through side effects of the medications, and also sometimes bearing and the ability to withstand the loss of life requires adequate psychosocial counseling, which is generally not available. So therefore, whom should this advocacy for the patient's need be aimed at? Quite clearly, we need to aim that at the government, both state as well as central. Now, state government and central government, though health is a state subject, often the laws are formed by the central government, and the state governments adopt the law or sometimes might tweak it a little bit here and there. Now, here again, neither are the patient advocacy groups or the patients themselves involved in the lawmaking process. And hence, often you get laws which are difficult to follow in a ground reality. So I think we need to do a lot of work on each of the requirements of this. If we think of kidney disease, we must start thinking in terms of how do we prevent this massive amount of kidney disease epidemic that is affecting us. We have to also understand that if we detect it early, then retarding the kidney disease progression is certainly possible, like excellent control of blood pressure and diabetes. If we did these two things, we would be retarding the progression of kidney disease in about 80% of our patients. If you looked at all these, then the government programs, both state as well as central, should be driven towards early detection and prevention. Now, huge amount of advocacy can be done, and our advocacy should include to the WHOs. Why? Because they are the ones who formulate some policies to make sure that the healthcare that is provided should be provided all across. It should be accessible to everyone. We have to advocacy, it should be done to the non-governmental organizations and philanthropists to set aside a certain portion of the money that they are going to spend on philanthropy, could be for patient care, and of which in today's situation, we are facing not only a pandemic of the corona, we are facing a huge epidemic of kidney disease. Now, if you looked at the registry data from the Indian Society of Nephrology, 17% of our population of adults is at risk of getting kidney disease in future. 17% of our people are at a risk, and a lot of this can be prevented. So therefore, the advocacy will have to start at a much lower level to all. We will have to go to the insurance companies to make sure that those patients who have taken out their insurances properly, their reimbursements are properly done, doctors' organizations. And for kidney disease patients, I would say we will have to go to the Indian Society of Nephrology. I have been attending the annual conferences of Indian Society of Nephrology, and never have we discussed what do patients need. And that was true in many parts of the world. I recently met Professor Praveer Chaudhary from USA, who was visiting us, and he conducted a survey of what do patients want as an outcome from their dialysis treatment, and what do doctors want. So the two surveys were simultaneously run as to what is the important outcome that doctors want out of their dialysis, and what do patients want. So two separate questionnaires, and important things to the patient was whether they can travel or not, whether they can eat this, that, and the other or not. But for the doctor, it was important to know whether adequate amount of KT/V was delivered or not, whether the blood pressure parameter was good or not. He didn't care whether the patient needed 6 tablets to be taken every day for just blood pressure. And the patient was worried about, why do I need to take so many tablets? So what the patient wants is not known to us. And therefore, the doctors' organizations, I think we must make an advocacy that the Indian Society of Nephrology or the Urological Society of India or the Indian Society of Organ Transplantation are approached that they must at least have one or half session every annual conference to sensitize doctors on patient problems. They must encourage doctors or these organizations to design studies to and surveys amongst patients to find out what are their needs and how can they best be met. We need to go to advocacy to treatment centers. One, to keep the costs under control, to have external auditing of their policies and treatments to make sure that the proper, evidence-based treatment is given to the patient without taking away the patient's autonomy. These are my thoughts about the advocacy for patients aimed at their needs. Well, I think that's what I want to say, and thank you very much for this patient listening. I bring greetings from my team. It so happens that my wife is a medical social worker, and for my patients, a lot of these advocacy needs are taken care of by her. So for me, it is easy, but you can't always have that kind of a support everywhere. So that needs to be created. So thank you very much for this patient listening.
Thank you, Mohan, for your candid analysis of the situation of patient advocacy and the unique problems in India. And you have been very honest to say that you personally don't have much experience in patient advocacy, which is very true. Even most of us don't have this, and that's why I really appreciate the Kidney Warrior Foundation for having this virtual meeting, and the inaugural session is on patient advocacy. Patient is foremost in our management, and I, on a personal note, I became a better doctor when I became a patient myself. You rightly said that we just don't need to treat labs alone. Lab parameters are important, but that's not important. More important is the patient. A simple example is when I had the heart attack, for me, the heart was not important. The constipation was more important. So I remember earlier days when the patient had transplant, transplant patient would tell me, I got constipation. I would foo-foo them. I would say, you had a life-saving transplant, don't talk about constipation. But when I had a heart attack and I had constipation, I realized that was more important than my heart problem. I think these are very important things. Patient advocacy, I think as a group now, the Kidney Warrior Foundation is doing enormous work. It is a beginning. I know it's very challenging, But right next speaker I have is none other than Vasundhara Raghavan. We can say she's the mother of Kidney Warrior Foundation. She got the idea of having the patient group because, as my previous speakers mentioned, as a kidney group, patient associations and even foundations are limited compared to cancer or heart. So this is a good beginning, and I would request now Vasundhara to talk on the patient's voice. I think that is the most important of the patient advocacy. The agenda is the patient's voice. If we cannot hear their voice, as doctors, we fail in our duty. So I request now Vasundhara to do our presentation. Vasundhara, please. Thank you.
Hi and good day to everyone. And today we have with us Vasundhara Raghavan, the founder of the Kidney Warrior Foundation, herself with us today. Good morning, Vasundhara.
Hi, Marian. So nice to see you across and to be received so warmly by you.
It's always a pleasure to connect with you. And I'm really excited because today we're going to be talking about a topic that is so important, patient advocacy. While we heard the doctors share their views with us, I'm really excited to know what you have to say on this topic.
Doctors have come a long way, and I think I didn't realize how far they have reached in understanding the patient and their requirements. But having heard them and understood that they are very compassionate, which I always knew because that is how we promoted at Kidney Warriors Foundation. We made the patients feel that doctors are there only for them so that they can respect the doctor and discuss with them all the problems. The important thing is discussing your health issue with the doctor, which is very important because patients generally are very conservative in expressing their thoughts and feelings. But today's session has given us a lot of ideas. But having said that, I think we need to define what the patients need themselves. There is a huge gap in what we are perceiving as the patient's role and the doctor's role, and the huge gap in their financial, emotional, and social requirements. The social needs of giving the emotional support is already being done by Kidney Warriors Foundation, but we are unable to help them financially and help them to meet all their necessities and requirements to face the disease with equal confidence.
So now that you've given us a gist or understanding of what is the major needs from the patient perspective, could you give us a little bit of highlight of what Kidney Warriors as a foundation has a plan to address these needs?
So we have understood that patients need insurance, that they need support on medicines because costs of medicines are very high, and it eats up their income. Like some people are saying 100% income is spent on the medicines and dialysis treatments, and they have to borrow from family and friends. So that is not a very happy situation. And if we are saying these are the people who are paying, that is, they are the, like you say, they are the taxpayers. So they are paying for their medicine, medical care. So they are not the people who are taking subsidies. So we need to look at them closely and see how we can address these problems. So we feel that we need to give them some subsidies for medicine. We need to give them some insurance. And more than anything, we have to see how to get them employed. Because if they are employed, some of these problems can be resolved. But being on dialysis gives them that huge disadvantage that they are unable to go back to work. After the session in the clinic, they are unable to go back to work. That is not something to do with their attitude, but it is something to do with their physical conditions also. And to address that, Kidney Warriors has also been recommending them on the diet, to manage their diet well so that they can manage the disease well. So we are trying to create all the necessary elements that will help them to manage the disease. But that can be only at a certain level. We need to go beyond. And we need to see how we can address their financial needs. Employment is one, insurance is one, medicine is the other one.
And diet is the fourth one.
Diet is the most important one. because that helps them to live. On the financial aspects, I feel if they are the members who are paying for their treatment, we need to have something like a P with PPP model. That is, the patient is the first P with public private partnership model. So introduce patient into the PPP model. That means a patient who's paying, he pays, even if he pays 70% of all his expense, some part can be paid by the Kidney Warriors Foundation or other NGOs. Some part can be paid by the private corporates and some by the government. So it makes it easy. It's not a burden on the government. It helps the patients, and we are able to manage many patients who are actually paying for their treatments.
Well, that being said, Vasundhara, so what are the initiatives that we have planned for 2021 to deal with this, the issues that we know that exist?
We are going to go bang on all these things. We're going to look at employment. We are looking at medicines, subsidized medicines, getting patients some benefits for medicines. Either we collect money, raise funds, and then we help them, or we are going to find out some good government sources. You know, the pharmacies that are there run by the government. In fact, we can even approach the government asking them to give us some sort of a pharmacy across India where these medicines will be available to them at a very nominal rate. So if they can make a saving of 1,000 rupees or 2,000 rupees in a month, that will also help them to manage their health better.
So thank you very much, Vasundhara, for sharing your views with us on the topic of patient advocacy, representing the patient body. And we do hope as a community, we're able to work together and take care of all the visions that we have for Kidney Warrior, be it employment opportunity, be it the financial perspective, the emotional perspective. Of course, I think we've already been doing a great job in the nutrition perspective. So thank you very much for joining us, and let's move on to what we have in store for you.
Thank you, Vasundhara-ji, for your thoughts on the patient's perspective. The next session, I think, is the most important session of the entire patient advocacy group. We are going to have a question and answer session, and all my speakers, starting from Vivek Jha, Dr. Bharat Shah, Vijay Kher, Mohan Rajapurkar, and Vasundhara will be joining us. And let's have the question and answer sessions, please. We have a set of questions which we have got from the public, and we are going to ask those questions to the panelists. Can we have the questions, please, on screen? Okay, now I think I will go put the question to Bharat Shah. Bharat, how much can we ensure that all systems and protocols can be uniform across the country? I've heard patients complain that post-transplant, there is very little support in small towns while having a rejection or a problem. I'm sure you're running a Narmada Foundation. You would be able to help us in this question.
So Sundar, today's program is an example how digital technology can make sure that uniform treatment can be provided. In this pandemic, a lot of new things have been learned and have been practiced. We do a lot of online consultation, and if patients have a problem, then we are able to guide them online, and that is how the practices are becoming uniform, whether someone is from a small rural area or whether one is from a big city. It is possible to counsel them at all points when they need our help.
Thank you, Bharat, for your analysis of the situation. I agree with you. I think the digital era has made things easy even for small towns, and I think that way we must thank COVID also for some extent, because even those who are not digital savvy are slowly getting into the format. The next question is to Vijay Kher, my good friend. We would like insurance company to extend covers for pre-existing condition, even at higher premium. Can the nephrologist through the organization help us to get this resolved? And Vijay, you being the past president of the ISN, I'm sure you will have some insight and tell us how we can go about this. Can't hear you properly. I think you are outside somewhere where there is no net connection. Can we go to the Vijay? Can we go to the next question? Okay. We are not able to get Vijay. Can you talk to us?
Hello.
We can
Hi,
hear you now.
Sundar.
Can you hear
You
us?
can hear me? Yeah, I can hear you, Sundar. Yeah, I heard your question, and I think it's important that it's a patient advocacy group where patients, nephrologists, the administrators, the healthcare providers, the health administrators all will have to work towards trying to see whether we can get, especially say, kidney donors who need insurance, health insurance, and this is not being provided to them. I think at certain local levels, at individual levels, this has been possible to get it for some patients, but I think as a general, I agree with you that this is something we need to fight for. And I think patient advocacy group like the Kidney Warriors group, along with Indian Society of Nephrology and other groups, can advocate to the health administrators and maybe the insurance regulators to find out how we can do it. And I am with you that this needs to be done, and we should work together to get this done.
Vijay, I think your point is valid. I somehow all the time feel that the patients feel that we doctors have got big lobby and we've got a say. But I personally feel the patients have got more voice because they can represent as a group. And I'm sure Kidney Warrior Foundation has got a good presence. And Vasundhara is on the panel with the government who can also take up this.
Yes.
But I'm sure like Bharat being in Bombay and you being in the capital in Delhi, you'll have VIP patients. Unofficially, I'm sure you can do something and help the patients group. Thank you very much.
Yeah, I think, yes, I think as a group, we should do this.
The next question is to Mohan. Mohan, since you run one of the wonderful dialysis and transplant units in the country with a lot of training program, and your wife Sujata is the counselor herself. So one of the questions we have is, how do we, can your group help us to train counselors as a body, whether we can, there are smaller towns and centers where they don't have counselors. So can we send them for training to you and will they get some certification? Can you help us out on this and throw your thoughts on what do you think on this training program for smaller centers to get counselors?
Okay.
Go ahead.
I heard your question and I was a bit confused because of the two devices, but now I understand what is happening. The training for counseling is a very specialized training, and anybody who's really interested and has basic intelligence can be trained for counseling. Ideal would be that hospitals and organizations have adequately trained medical social workers who have also got some background in psychology. Sure, we'll be happy to help any organization to train their people in method of counseling, and I'm sure Sujata will agree with me to help any organization who requests her to, particularly in this digital age, to train people on methods of counseling for a particular disease or counseling in general. So yes, that sort of a thing can be organized, particularly as a team. Now, sending your people to our hospital, you would be welcome, but today with the travel restrictions and stay problems and the COVID going everywhere, it may not be immediately possible. Immediately, it would be possible to do training on, say, Zoom platform or any of these digital platforms where we could get expert counselors to teach people how to actually counsel, what should be the body language, what are the communication skills, how a positive spin can be given to a situation which is essentially negative. They can also tell them what are the ways by which help is available, both financial, psychological, social help, finding resources nearby and in general. that certainly can be arranged. I don't think that's a major problem.
Thank you, Mohan. I think since I also come from an educational institution called Manipal Hospital, and Dr. Balal being the chairman of the hospital, we can also offer from our university some sort of certificate or diploma, which will help these people to get recognition as a counselor and also get employment. I think that's also important. Now, since Vivek is back and he seems to be in his farmhouse, I would request Vivek is one of the few people who has been the president of the Indian Society of Nephrology, president of the International Society of Nephrology, so he can probably tell us whether we would like to be included in the ISN and other organizations for efforts to make organ transplant law. And I know that as ISN, you had the Istanbul declaration, you've done a lot of work on this. So can you tell us how we could go on this?
Thanks, Dr. Sundar. So most professional organizations around the world have recognized the value of increasing consumer voice or patient's voice in their activities and the various research, education, advocacy plans that their expert groups are making. I'm sure, at least in the professional community, there is great awareness of the SONG initiative, which is the Standardized Outcomes in Nephrology initiative, which looks at really picking up what are the preferences of patients. For example, as doctors, we are very focused in deciding what to do for a patient based on our perception of what is good or what is bad for that patient, and we often end up making an assumption that we know what to do for that patient, and this is exactly what the patient will also find appropriate. We have reached this position from decades and decades of understanding that often our patients will say, doctor, do whatever you think is best for me, and that's great. But I think as the information asymmetry which used to exist, at least in the past, has dissipated with increasing sources of knowledge for patients, for general public, etc., in particular facilitated by groups such as Kidney Warriors and many other groups, that information asymmetry is slowly reducing. It is also our responsibility to make sure that the gap comes down, and most professional organizations, including the International Society of Nephrology, have understood that. Just to give you an example, some months ago, we carried out a global consultation on appropriate kidney failure endpoints. And typically in the past, those conferences would have only nephrologists or other public health researchers, epidemiologists, social scientists, statisticians, etc. But we made sure that we invited half a dozen patient representatives, because only the patients can tell you what does it mean to be with kidney failure. None of us have had the personal experience of living with kidney failure, and if we don't include the voice of those who have had that experience, we would be doing a great disservice to them. So I think this, Sundar, this is a rather long answer to your question, whether the International Society of Nephrology is welcoming involvement of patients. So, we can abbreviate this to say that, yes, we are very much welcoming those initiatives. I think the patient should not feel that their voice is not going to be listened in the future, and they should not feel either overwhelmed or intimidated by in the presence of a large number of nephrologists who as people like you and me, we are often very fond of speaking and making sure that we put our viewpoints in without realizing that we need to give adequate chance to the person across the table to express their wishes. So that was number one. The second point was about the organ transplantation law. So organ transplantation, of course, each country has its own legal framework, but I think the general principles of what guides the development of organ transplantation, in particular protection of everyone who is involved in this very, very noble act of charitable act donation and kidney transfer between different organizations, different institutions, different states as well. So I think we all understand that it's critical that for making sure that we as a community we have respect of the patient patients, respect of the society. We put in place processes that are transparent, that are equitable, and we should be prepared to be judged on how we are making progress on that. And so the Indian Human Organ Transplantation Act, in the in the bare bones of the act is quite good. The challenge that we face is in how we implement the measures of that act, and that is a responsibility for us to work together, and we must hear the voice of the patients there as to what are the challenges that they face. And people like Dr. Bharat Shah and others have done remarkable job in voicing those concerns. For example, how difficult it is sometimes for patients to get various kinds of permissions which are required across various state boundaries and so on and so forth. And in many instances, those permissions do not make sense. They have been put in place by some bureaucrats just because they're used to doing bureaucratic work, and they want more paperwork, they want more signatures, they want more approvals. It is our job as physicians and surgeons of dealing with people whose lives are at stake, to act as advocates for these patients, really, and make sure that the voices of these patient advocates is included in the legislation, and how the rules that govern those legislations are implemented in different countries. But going back to the point of the need for global cooperation, the need for global cooperation to make sure that we operate within the context of a broad, globally acceptable ethical framework. That's really critical. And that is where organizations like the ISN, the Transplantation Society, which came together to form the Declaration of Istanbul Custodian Group, which gave its recommendations in 2008 and revised them in 2018, which have been widely accepted by all professional societies. They have also been accepted by the World Health Organization, so the WHO principles of organ donation, etc. But I think I would reiterate the principle that we should keep the patient in the center and make sure that any such law is in the service of making this whole enterprise easier for the patients and not more difficult and not more opaque. But thank you for asking that question, Sundar.
Thank you. I think I agree with your point, especially bureaucrats being involved. In fact, in Tamil Nadu, the KWF program picked up because of a proactive IAS officer called Dravid. I'm sure all of you met him. And he did a lot of work, even though he was not in the health department, he got shifted out, but he took as a personal challenge. Even after retirement, he's quite involved. I think that's important. And I also personally feel that if you have VIP patients, they will make a lot of difference in many of these government regulations going off. Like in Tamil Nadu, I keep saying it's because of one man called MGR who had kidney failure. The entire scenario of Tamil Nadu changed for pro-organ transplantation and management of kidney failure. Now, one other question which has been asked, I think I will take this question because of my personal experience. It says, can we dialysis patient be employed in dialysis center? I think it's a very important question. I remember a patient of mine who came to me 30 years ago with kidney failure, and the daughter was a young girl, 16-year-old girl, who was actually doing lab technician course. Then I told her that you should get trained in dialysis. She got trained in dialysis. Now she's one of the top trainers in Davita. She's gone around the world. She used to come from a small village, but now she's achieved so much. Her name, I can say, Gayatri Bala, who's done a lot of work. And right now in Manipal Hospital, we have one of the senior transplant nurses. He himself had a transplant. So because of it, a lot of my patients come and tell me that fellow is doing such a great job because he has had a transplant, he understands our problem. I'm sure if we can employ dialysis patients in any of these dialysis nurse or transplant nurse, things will be better because they know the scenario. In fact, I got quite a few of my patients who are married dialysis nurses and settled well and doing well. So I'm not suggesting that it should be a romantic thing, but I'm sure it's an important concept. I'm sure all of us in dialysis units, we have such stories where the dialysis patients have had treatment, they come back and joined us. In fact, one of my earliest transplant surgeon, young surgeon, he joined me because his father had a transplant with me. So like that, I think it makes a difference if you have people who understand kidney failure as a family. I think they are more empathetic and it makes a lot of difference. I'm sure we can even encourage that those people who had transplants or on dialysis, we should employ them, and this should be a process and we should go ahead with that. Now we have one more question to Vasundhara because she is part of the Kidney Warrior Foundation. The question is, how can we improve the cost of medication? I'm sure you will tell us that the doctors are involved, pharma is involved, but as a patient body, what do you think, Vasundhara, we should do to reduce the cost of the disease, to manage the disease better? Because in transplant. It is not actual transplant cost, but the post-transplant medications. And there are so many brands available. The costs vary. The generic costs are different. The innovator brand is different. What is your view? How do we go about it? Work together in helping the patients.
Cost and implications for maintaining either dialysis or post-transplant is very huge for patients, for individuals, because people are paying from their pockets. If you say 6 lakhs is spent in a year for dialysis, it's a cost that a person would take a family vacation. So these families have no vacation. They lose their properties, they lose everything. The use of this money, if somewhere we can get a model where the government, the patient bodies, private bodies, corporates join in, and the patient himself pays an amount, so there can be some sort of a relief. It's a very it's not a non-viable proposition. It has to become viable, because otherwise the medicines are very expensive. Patients cannot buy the medicines post-transplant. I know a farmer who had a transplant, and then thereafter he had to give up medications. And today we don't have a database of how many people are surviving after transplant, because we don't know how many have managed to buy the medicines and are continuing to live with the transplant. So, you know, we can never have a registry for us in India, because we can't understand how many people are continuing either on dialysis or post-transplant. Maybe the doctors have some records, but as a patient body, I'm unable to understand. And the fact that they are paying for dialysis and they are still cribbing when they are paying subsidized dialysis at trust centers, even then they find it difficult to manage. So that itself is a indication for us that there is a need to look at cost aspect very critically. We need to understand that it's not a very easy task to manage this disease with the additional financial burden. We can't get the pharmaceuticals to give us concessions, because, you know, they have to pay their taxes. And there is a big, long journey for them to reach to the patients. But we need to find a model where it can make it easy for us. Today, Kidney Warriors Foundation is giving patients subsidized medicine where we are contributing. But how many patients can we serve? That means we need to have so many crores of rupees so that we can help them. So, you know, this is a very difficult situation for us. We want to be there as a service, as a body that joins everything, for the nephrology, the doctors, the pharmaceuticals, the government. But where can we place this money? Where can we find this money? That's a question that I have. But if we can work on the cost, we can get some sort of standard taxation across the country, some rebates for kidney patients, because theirs is a long-term expenditure on medical treatments. When they start from dialysis, it starts actually before that, CKD stage. When you start spending, then the fistula is created, then the fistula fails, another fistula is created. So these are the costs that we are very bothered about. So let us see if all of us can put our minds together and come out with a solution which will be good for the patients, for the government. We don't want to burden anyone. And if private sector will help us in some way, that will be the best thing to happen.
Thank you, Vasundhara. I think we are end of the session. I think I would like to conclude by saying that the Kidney Warrior Foundation has brought up this concept of patient advocacy. I think now with Vivek and Vijay and all others being here, Mohan, Bharat, it's important. I think the Kidney Warrior Foundation or the patients group, they get involved in our annual meetings also, the ISN or ISOT. I know the ISN has got a separate wing for patient advocacy. I'm sure like that, Indian Society of Nephrology, organ transplant, we should involve the patient body, which we have never done that. As Mohan was saying, that has never been the concept. We have always worked as a separate entity, as a doctor's entity or whatever. I think we should involve all of them, and some may come to some sort of conclusion and help them out. And as Vasundhara rightly said, how much, I think as an association, there is a limit to doing, how much can we give donation? Even a rich man going on giving a recurrent basis is not easy. It's not, unfortunately, transplant or dialysis, kidney failure is a recurring expense. It is not like a cardiac surgery where you give one-time grant. You give 1.5 lakhs or something, they do a coronary bypass surgery, and there is no expense after that. Whereas here, it's a recurring expense. I know philanthropic friends of mine who said they will support transplant. After a few months, they come and tell me, can this medicine be stopped? We want to help more people with tuberculosis, malaria, instead of helping your patient. They don't realize that it's the recurring expense. I think these are things only the patient body and doctors, we have to work together to get this done. At this outset, again, I would like to thank the Kidney Warrior Foundation, all the organizers, and also my good friends, starting from Dr. Balal for inaugurating the conference, Dr. Vivekanand Jha, he's a very busy man, I know that, holding many hats, Dr. Vijay Kher, Bharat, and Raja Purkar for helping out in this meeting. Bharat, you're lifting your hand. I'm sure you got some questions. We've got a few more minutes. Go ahead, Bharat.
So, Sundar, that was essentially the main part of my talk. There is not much that we can do for our patients with end-stage kidney disease. Even today, barely 10% of patients with end-stage kidney disease can go through the 2 treatment options available. And therefore, I emphasize in my talk that we need to educate our people about prevention of kidney disease. And as kidney warriors, while we will continue to work to support patients who have kidney disease and advanced kidney disease, I think these kidney warriors should work to guide people how to prevent kidney disease, what mistakes they make. Today, a large part of my patients that I see are children of patients whom I treated 25, 30 years back for diabetes, diabetic kidney disease, and they are going through the same sequence. And that is how I'm now targeting more on guiding not only them, but their children, that they should not follow the same sequence. They should take care of their health now, make sure that they don't have diabetes. If they have diabetes, take good care of it. This is what we need to educate our people.
I think, Bharat, you brought an important point. In a country like India with a 1.3 billion population, everybody cannot get free treatment. I think prevention is the key. As my guru, Dr. B. Magade, keeps saying, swasthasya swastha rakshitam. Keep the well healthy. I think that's important. That's what you said. And again, I would like to conclude, and I hand over the stage to the organizers, Marian and Vibha, to go ahead with the next important session, which is going to be the Amar Gandhi Foundation award session, I think. Marian, can you take over now? Thank you, all of you. Thank you for the participation. Thanks a lot.